right. Welcome, everyone. Welcome to the Association of Caribbean Higher Education Administrators, also known as ACHEA, our webinar entitled Health, NCDs and Misinformation. Before we get into that, I am just going to ask once again, if you could just put a thumbs up in the chat just to show that you are okay, that you're hearing everything, that you're seeing everything that you need to see, and all is well. And at this time, I also want to take the time to acknowledge our president, the association's president, Mrs. Marvet Facey Thompson, and the ACHEA team. By all means, to welcome them and acknowledge them. Some will be joining in and out and so on, because we're all balancing our different commitments and so on. So Thomas, thank you so much. Thomas is here as well. Now he's the chapter chair for Barbados. And all of this can be seen on our, let me just post the chat in the chat, the link to our website, which will include some of the various content that you might need. Sorry. Please start again. All right. Regarding our upcoming conference and any things happening in the ACHEA sphere of things. All right. So by all means, you can bookmark that link, and you're gonna get all of our information in terms of the executive team, the conference, all that we do, membership even. So if you'd like to become a member, by all means, you can join us via the website as well. And we do have some information on the conference, which I think we'll probably present at the end of the session. But for now, you can hold on to that link, and because I want to give our presenter as much time as possible to present. Now, so without further ado, I'm just gonna hand over to our guest presenter. And before we do, I just want to give you an idea of who this special guest presenter is. Dr. Brian Chadee is a certified medical doctor, currently doing his master's degree with a specialization in obesity and weight management. He practices preventative medicine, treating lifestyle-related and chronic diseases. He is also a graduate of the University of the West Indies, UWI. Additionally, Dr. Chadee is the CEO of the Gym Clinic, a facility that helps persons in pursuing healthy lifestyles through proper diet and exercise. In essence, Dr. Chadee's, in my opinion, Dr. Chadee's professional practice can perhaps be summarized, or perhaps reiterates the saying, prevention is better than cure. We've all heard that before. Yeah. So without further ado, I'm just going to hand over to Dr. Brian Chadee to do his presentation and provide some insight to us and help us all. Dr. Chadee?
All right. Thank you so much, Justin. Well, I think you explained, you covered everything that my facility and what I am about very good. So I don't need to go and explain much about myself anymore. Just a little bit I would just add on is that I started a facility called the Gym Clinic, as you may see here in the beginning of the presentation, about 2 years ago. And the reason I started this is because, again, as you said, prevention is better than cure. And when I used to work in the hospital, the public hospital, I would have like 5 to 10 minutes with a patient. And I would tell the patient, we all know the power of exercise. Exercise is the best medicine, proper nutrition. But you would tell them, yeah, you need to do this exercise and stuff. Yeah, come back in 6 months and we'll see how the disease progresses. But we haven't really seen much progress with just that, telling the patient they need to go to this exercise, they need to change their diet and stuff. So it's like, what if I create a facility that the doctor's office is in a gym, and I can actually give them what we call an exercise prescription, and I hand them off to a trainer, a coach, and we see that behavioral intervention translate into a better health outcome, right? So that is the basis of my facility. So today I'm very excited to, I would say, present these topics to you guys, because I heard that we have a very diverse audience today all over the world. And NCD, non-communicable diseases are diseases that you can't transmit from one to another. It's more lifestyle diseases. And I think the entire world is plagued with this alarming rate of chronic diseases and lifestyle diseases right now. So it is something I'm very passionate to talk about, right? So let's get started. All right, so just a general, some general information on what exactly is health. Well, according to the World Health Organization, it's a state of complete physical, mental, and social well-being, and not just the absence of disease, right? This sentence right on the definition, I want everybody to kind of fixate on this. The human body is complex. Many factors affect your health. And the causes of diseases and health are multifactorial, such as your genetics, your environment, your income, just the way you were grown up. All these things affect your health, right? Your access to healthcare, all these things like that, right? Just a naked switch. All right. So I just want to talk a little bit about the social determinants of health. And as I said before, they are the conditions in which people are born, they grow, they live, work, and age, right? So things like your socioeconomic status, education, your neighborhood and physical environment, your employment, social support networks, and access to healthcare. Now, health is so complex, and I always like to use this example, is that doctors, for example, they need to study about 7 years just to become a doctor. Then they need to actually go and further subspecialize into each organ. For example, the heart, brain, your lungs, and that is another 5 to 7 years, right? Health is so complex that we need as much expertise as possible. All right, so I want you just to guys kind of just hold on to that sentence, that health is complex. All right, so yeah, just some examples here of social determinants of health. As you see, different contexts, health coverage, employment, your income, all these things can affect your health. Right, Justin, you can switch. All right, so this is from the American Heart Association, sorry. And I have this actually plastered on my facilities wall, because I think it is a very good foundation, eight building blocks for good health, right? So the one in the green there, you just with the fish and the carrots and the apples, that just stands for proper nutrition, right? The one right below it, the guy exercising, of course, physical activity, that is very important for good health. That other one below, that is your blood sugar readings. So blood sugars are good, sustained healthy reading is good for good health, right? The other one is maintaining a healthy weight. The other one that you see in there is lipids, that is the cholesterol, your triglycerides, all these things important for good health and to decreasing your risk for chronic diseases. Above that, we see a blood pressure cuff. Of course, know your numbers. A good blood pressure is less than 120 on 80. If you're in your 30s and your 40s and you see those readings start to go up, it's important that you go see your doctor, right? Of course, no smoking. No smoking at all is healthy. So we have an X there by the smoking. And the last one is proper sleep. All adults should be getting 7 to 9 hours of sleep every day for good health. Now, how many of you all think you're meeting those requirements?
Especially when you're working hard, right?
Correct, right? You see so much factors can affect your health, right? It's not just one thing. And a lot of what I'm going to explain here is what we practice, evidence-based medicine. So everything is backed by the highest quality of science available, right? Right, Justin, you can switch. All right. So I just need a little, and you guys can stop me anytime to ask questions, right? I just want anyone to just tell me if you guys know what is the #1 killer in the world today. Every 33 seconds, someone dies for this. And this is affecting even 20 to 30-year-olds now. Anybody?
Let me
All
see.
right.
Chat, Rosita, Latoya, Carla, Sandra. Anybody want to take a guess? Someone said heart disease.
Very good. Very good.
Stroke,
That's
heart
excellent.
attack, diabetes.
Correct. All right. Next slide. Right. So this is just, I pulled this up. Heart disease is the leading cause of death worldwide. And I just have some data here from my country, Trinidad and Tobago. And again, it is consistent with the rest of the world. So the number one cause of death in Trinidad and the world, and most likely the rest of the Caribbean as well, is ischemic heart disease, right? Every 33 seconds, someone dies from heart disease. You can see heart disease and diabetes kind of battling it out right now for the number one killer, right? Right below there, we have stroke and kidney diseases. So 100 years ago, this was not the case. 100 years ago, we had communicable diseases. Those are infectious diseases. Those are the diseases who were killing us out 100 years ago. Now we're seeing these, as I was telling you, the alarming rate of chronic diseases, lifestyle diseases, diabetes, high blood pressure, heart disease. This is the number one killer, right? So we need to do things to bring down this level, right? Any questions?
Not so far.
All right, next slide. All right, so what are the risk factors for heart disease? Well, it's very important that we distinguish between things that we can control and things that we cannot control, right? And don't let anybody, remember, part of this presentation is about misinformation as well. And don't let anybody tell you can control things like your genetics or your environment or the policies of our government. We have no control over that. Yes, we can advocate for better health policies, cheap access to cheaper foods and things like that. But on an individual level, we want to think about things we can control. All right. So some examples of non-modifiable risk factors, things we cannot control for heart disease, diabetes, high blood pressure, is our genetics. What God gave us, what God gave us, what our parents gave us, what our ancestors gave us. Now, unfortunately, I would say that I'm speaking on behalf of Trinidad right now. We are a large proportion uh, um, of our population from South Asian descent, which is East Indians. The second largest would be African Americans. Now, these two subgroups, and this can explain why we have such a high incidence of diabetes and heart disease. This subtype especially is very, very prone because of our genetics, our genes. We are very, very prone. Bare belly, fat surrounding our organs. That is something we cannot change, right? That is something that we have no control, things we can control, right? Such as I said before, physical activity. We could be more physically active. We could eat a more nutritious diet. We could try to get 9 hours of sleep. We can do things our stress levels. We can be able to take risk for these diseases. All right. All right. Next slide. Right. Just making sure everyone is hearing me.
Yeah, I just took off the video, so it should help now.
All right.
You're just breaking up a little bit.
All right, good. All right, so I just want to talk about diabetes. All right. All right, you hearing me now?
Yes, go right ahead. Thanks.
All right. So diabetes mellitus, right? I want to talk a little bit about diabetes mellitus. Now, there are many different subtypes of diabetes, but for the purpose of this presentation, I just want to talk about 3, right? Probably heard about type 1 diabetes, right? Type 1 is basically early. What this means is that basically this is a subset of diabetes we see in more younger people in childhood. And it is because of the pancreas inability to produce enough insulin, right? So there's basically a deficiency in insulin. Type 2 diabetes, now that is the one that we get as adults. This is the one that is more prevalent. This is the one that everybody basically talks about around the world and in Trinidad, right? And we call this late. What this means is that this is, as opposed to type 1, when you have a deficiency in insulin, the pancreas is not producing enough insulin. This is basically the opposite. The pancreas is producing enough insulin, but because of that same issue I told you guys before, the tissues become resistant to insulin. So we call this type 2 diabetes or insulin resistant diabetes. So the insulin is being produced, but it can't respond. The tissue can't respond appropriately because of all that fat surrounding and because of our genetics and our sedentary lifestyle that just makes things worse. All right. So the last one is gestational diabetes, and this is just basically diabetes that you get in pregnancy. And just something to note for the woman, if you get gestational diabetes or diabetes in pregnancy, it can be reversed after your pregnancy has finished, but it increases your risk significantly for developing type 2 diabetes later on in life. So you're gonna really have to be monitoring your blood sugars regularly, making sure you're having proper exercise, nutrition, all these things like that, right? Now at the bottom of the slide, I have something called mild diabetes. And as a practitioner, so this is something that I really wanted to talk about for pre-diabetes. So I have a lot of patients in my 20s and 30s now who are coming to me and we check their blood sugar. We just do a quick screening, a little finger prick, and a lot of their values are in the pre-diabetic range. And a lot of doctors would tell them, you just have mild diabetes, just watch your diet and stuff like that and exercise. And in a year, most of them actually go on to develop full-blown diabetes. So I think as a doctor, I really want to stress about this thing called pre-diabetes. And the reason I want to stretch on this is because just the next slide, you can skip to the one with pre-diabetes. This is mild diabetes. That's 2 slides ahead. Got it?
Yeah. Can you
Right.
see it? Yeah.
Yes. So more than 1 in 3, this is from America, but as I say, when America sneezes, Trinidad catches a cold, or the rest of the Caribbean catches a cold. So basically, this population, this kind of reflects, it's probably even worse. We don't have data for this in Trinidad or the Caribbean, but it's probably around the same, right? So more than 1 in 3 Americans have pre-diabetes. Just think about that. More than 1 in 3 have pre-diabetes, right? Now, as I said, I really want to talk about it because pre-diabetes is what we call reversible. You can't erase that. You can go back to normal blood sugar values. But once you hit diabetic, which is just a little higher blood sugar, blood glucose levels, that is, as evidence-based practitioner, and I know people will come with the claims and say you can reverse diabetes, but if you really know the science behind it, you cannot reverse diabetes, type 2 diabetes. You can put it into remission, and you can put it into remission with just lifestyle, exercise, diet, maybe some medications, but once you hit diabetic level, you cannot reverse it. All right, you can control it and you can put it into remission. However, pre-diabetes, as I say, is a sweet spot that you can reverse it. So I just want you guys to remember that, right? Justin, you can just go back there, go back to the last slide. All right, so just for some information, I know a lot of you guys will be doing your blood tests and stuff like that soon. A very good blood test for you guys to know. And just like your blood pressure is something called the HbA1c. And this HbA1c value gives you your average blood sugar reading over the last 3 months. And normal is less than 5.7, between 5.7 to 6.4. And we're giving you a lot of information. I hope I'm not going too fast. Between 5.7 and 6.4 is pre-diabetic range, and above 6.5 is diabetic range, right? So between a HbA1c of 5.7 to 6.4, that is the sweet spot. That is a diagnosis of pre-diabetes that you can reverse. All right. So what is the cause of diabetes? What is the cause of pre-diabetes? So I had a few patients actually, even recently last week, and they were diagnosed with diabetes. So the first thing a lot of them would tell me is that, Doc, I don't eat plenty sweets. I don't even like sweet stuff. How I develop diabetes? Well, I have to take about 5 minutes after they give me that statement, or 10 minutes, because I really like to make sure my patients understand the pathophysiology or the cause of this disease, right? Because you can't treat a disease if you don't know the cause, right? Sugar does not cause diabetes, and this is a great myth. Carbs do not cause diabetes. So again, remember that I told you this is a complex, and good health is also complex because a lot of things are affected. Now, the cause of diabetes, just making sure you guys hearing me.
Yes, a little choppy at times, but we're hearing.
Well, what is the cause of diabetes? Well, in a nutshell, type 2 diabetes I'm speaking of because this is the one that is more prevalent and that is wreaking havoc on the world's population, especially Trinidad and our Caribbean brothers and sisters. But the cause of diabetes in a nutshell is this is like how I like to describe it. It is an interaction between our genes that I just told you that we inherited, especially East Indians. It is an interaction, I would say a toxic relationship between our genes and our environment. Now look at our environment. Fast food everywhere, elevators, cars, public transportation. When you guys log off from work, right? When you guys get home, you're still working because everything you're always connected. The poor sleep, all these things are our environment. So this environment that encourages sedentary lifestyle and overconsumption of calories, that mix interacting with bad genes, that is what causes diabetes, right? Sugar doesn't cause diabetes, but I'll tell you why people think sugar causes diabetes. Because when you're eating a big piece of cake, you might overhear somebody saying, gosh, I hope I don't get diabetes. Now, I said something very important. That is, it is an interaction between our genes and our environment, and an environment that encourages overconsumption. Now, in general, if you take things like sugar-sweetened beverages, a Coca-Cola, a Sprite, fruit juice, or a cake, a cookie, right? Yes, it has a lot of sugar, but you know what else it also has? A lot of calories. And how easy it is to overconsume sugar. Well, sugary foods are delicious. It's very easy to overconsume. So it is really the overconsumption of calories, not sugar. If you eat a lot of calories in general and you gain weight, you develop that as I say, that fat surrounding your organs combined with your genes, that is what is gonna cause diabetes, right? Now, of course, if you are diabetic, then sugar becomes a problem. Because as I said, your body has an inability to regulate that glucose levels because of the inability of insulin to respond properly, right? So yes, if you are diabetic, then you're going to have to be extra vigilant with sugars because sugars spike your blood sugar levels. All right. But just for example, I want to tell you that fats, for example, you can overconsume fats. Fats are very calorie dense. 1 gram of fats is 9 calories versus a gram of carbohydrate or protein, which is 4 calories. So fat, yes, fats is fattening. All right. Everybody following so far?
So in essence, for clarification, you're saying, Doc, that it's not so much the sugars we look at, but the calories that we
Calories in
that
general.
can make us pre-diabetic or diabetic, or
Well,
both.
pre-diabetic is a precursor to diabetes.
Yes.
So you're gonna eventually, before you become diabetic, be at that pre-diabetic stage. And that is why it's very important to do your screening, to do your blood test, to know your family history. And most people have a family history of diabetes in their family. So to know your numbers, go and do your preventative, your wellness, your screening blood test. You know, look out for your signs. Go see your GP, your family doctor, before you go develop, as I say, you reach into that diabetic stage.
So
All
quick
right?
question. Thanks so much
Yes.
for that. Quick question.
Yes.
Why is there a misconception that when persons eat too much sweets or sugars, there is it predisposes you, or you automatically have diabetes, as opposed to saying, okay, your calorie intake is too high?
All right. Good question. Good question. So in general, let's just say a normal person, right? They would to go drink 10, 20-ounce Coca-Cola. Normal person, right? Their blood sugar levels would go up, and then the insulin will bring it back down. So there would what we call a transient, an acute spike in their blood sugar levels. But that is not diabetes. Diabetes is when there is a prolonged spike or uncontrolled blood sugars for a long period of time.
Right.
So it will go up and it will come down. Your body will respond naturally. You know what else causes a glucose spike? Exercise. When you exercise, your body needs glucose, right? So your body is going to release glucose, and you will if you check your blood sugar, it will go up when you exercise. So there's a little bit of fear mongering with respect to that. Of course, I'm not going to tell you drink 10 Cokes or whatever. I just want you to understand that the sugar itself is not really the problem. It's the overconsumption of calories, right?
Nice.
And remember that if you kind of correlate these things, 20, if you drink a 20-ounce scoop, that is 200 calories, right there. You eat a cake, that's like 400 calories. And sometimes if people are eating 1 to 2 to 3 servings of these sugar-sweetened foods and beverages. So it's really the calories. But what I want to say, so that is in a healthy individual, right? In a diabetic person, someone whose body isn't able to properly regulate glucose, I would advise them to watch their sugar intake more diligently. Be a little more stricter, because remember, as I said, that blood sugar in a normal person, the sugar will go up, but their body will, and it will bring it back down. But in a diabetic person, the sugar will go up, but it will have a problem bringing it back down. So there might be a longer sustained release of blood sugar glucose levels.
Right, thus being the whole diabetic condition.
Correct.
Someone is saying well, asking a question, Annette is asking, so calories, other calories from other sources besides sugar?
Yeah, so calories come from all your macronutrients. Fats is another one. Protein is another one. So just in general, 1 gram of 1 gram of carbohydrate is 4 calories. 1 gram of protein is 4 calories. And 1 gram of fat is 9 calories. 1 gram of alcohol is 7 calories. Just for your information.
Wow.
All right, so foods have calories. Calories matter, and the type of calories matter. So now I would just say it's not just how much calories you're eating, it's the type of calories as well. Because an apple have about 100 calories, and let me just say half a cookie has 100 calories. But which one you think healthier? The apple, obviously. The apple have the vitamins and the nutrients and the fiber. So quality of food matters, and the quantity of food matters.
Nice, good to know. Good to know. It's good stuff.
Yeah. So I know right now I'm just kind of touching the surface of each thing, because there's a lot of stuff to go through. But if you guys want in the future for me to just focus, especially on diabetes and stuff like that, we can always arrange that, right?
Most
All right.
definitely.
Yes. So let's go on to overweight and obesity. This is my specialty here. All right. So overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health, right? That's according to the WHO. Now, in 2011 in Trinidad, we had a survey. This is from the World Obesity Federation, and 33% of our population were overweight, right? This was using BMI, a BMI above 25. In 2024, the Ministry of Health of Trinidad partnered with PAHU when something called a STEP survey, and they found that doubled in 14 years. So in Trinidad right now, 66% of our population are overweight. What do you guys think about that statistic? More than half of our population is overweight. And obesity contributes to you developing diabetes. heart disease, kidney disease, osteoarthritis. It is also a risk factor for cancer, right? Again, remember something I said, health and disease is complex. Do not link this, and there will be some charlatan on social media linking this to one particular thing, but it's multifactorial. And you just need to keep that in mind. And treating these things are very, very difficult. Even in America, Dubai, all over the world, people have problems treating these diseases because it's so complex, right? Now, what is the cause of overweight and obesity? Well, it is a chronic relapsing disease. It means that, and if you think about that sentence there, chronic relapsing disease, how many people go on diets and they lose weight, if they lose weight, and keep the weight off? Not much. We have statistics and data to show that even if they lose the weight, the majority of people gain back the weight. And that is because it is a chronic relapsing disease, because the diet's unsustainable. So they go on a diet, they cut off whatever foods. And when they 2 months, 3 months, 6 months mark, they stop the diet, they just gain back the weight because they're not targeting the root cause of overweight and obesity. With it, and it's very complex again, hormonal, genetics, our environment, all these things like that, right? Right. So these are just some things that I say that contribute to someone being overweight. Up to 70% of your genes can make you overweight. Now, think about that. Is that fair? Is that fair? No, it's not fair. Because you seeing someone who overweight and you skinny, you never struggle with any weight problems your whole life, and you just there and you're thinking, and this is the whole another topic on weight stigma and on fat shaming and all these things like that, and you just thinking, wait, these people are so lazy, why they don't get to the gym? Well, look at where genetics come in, right? Look at access to healthcare. What about their social status? What about the environment? Can they afford healthy foods? All these things you have to think about, right? And that's why I tell you, on an individual level, yes, we have a responsibility to go work out, to eat fruits and vegetables, to do all these things. But there are so much other factors. And this is why we need government policies and all these things like that to address these alarming statistics, right? All right, so I already went through the American Heart Association's Essential 8. So we can skip that. Let's go on to nutrition there, Justin.
Yeah.
Right? So a very wise man by the name of Michael Pollan, and I stand by the statement. And I think in a statement is very simple. It's not easy, but it's a very simple statement that I think that most of you all should try to abide by and follow. And if you can do this, it will help you guys tremendously. So he said this thing. He said that to eat food, not too much, and mostly plants. Now, I love that, right? I really like that because by following this diet, you're going to get a lot of micronutrients, your vitamins, your minerals, your fiber. We know how important fiber is. You're going to also reduce all those bad fats, the saturated fat that's linked with heart disease, insulin resistance, and the overconsumption of calories, right? So this is a very good diet to follow. There are a lot of similar diets that kind of link with this one, and those are like the Mediterranean diets, the DASH diets, all these things like that. You guys probably heard about those diets. So those are good diets to follow, right? So eating a variety of nutrient-dense foods, very colorful foods, fruits and vegetables. Now, the World Health Organization recommends eat 5 servings of fruits and vegetables a day. Interestingly enough, according to the PAHO survey, only 7% of Trinidad is meeting those requirements. Now we could understand why we have so much chronic diseases, because fruits and vegetables, and I tell all my patients this before you go and bust that supplement and take this thing for your energy and whatever, try to increase your fruits and vegetables because they are so important for decreasing the risk of the diseases. They prevent against cancer, they help you to lose weight, they help give you good bowel movement. Fruits and vegetables, 5 servings a day, right? You got to prioritize whole grains. Now, grains are things like rice, whole wheat, barley, rye, oats, all these things. Those are the kind of carbohydrates you need to eat. Lean protein are things like fish, and chicken breast, right? As well, lean protein sources. You can have your red meat and stuff, but again, you need to know your risk for cancer, your risk for heart disease, all these things like that. I am not going to tell anyone to avoid any foods. There are no good or bad foods. It is how often you eat these foods, right? So you can have your pork, your beef, whatever, but just eat them according to your risk profile. Everyone is different. But prioritize, as I said, the chicken and the fish, mackerel, sardine, tuna, salmon. Those are good stuff where they get in all the omega-3s and the good fats, right? I told you guys food quality and food quantity both matter. They protect against NCDs. You can go and read up on the Mediterranean diet. All right, so exercise. Well, this is a kind of no-brainer. Everyone knows that exercise is really good. This is the whole premise on why I built my facility. Just some recommendations from the CDC and the WHO. You should be getting about, everyone should be doing cardio exercises and resistance or strength training. Every single person, including a child to elderly, so child, adult, elderly, every single person needs to do this for good health. Cardio, you need to meet 150 minutes a week minimum. Resistance training, that's like going to the gym, doing push-ups, lifting weights, yoga, all these things fit in this criteria, at least 2 days a week. So you have to do both. A lot of times I see patients, especially over the 40, 50 years, and they would say, yeah, doctor, I just exercise, let's go for a walk in the park and stuff. I was like, that's excellent, keep that up, but you have to build muscle. Why building muscle is good? Muscle is a very, very indicator of good health. And same thing with the diabetes. More muscle mass you have, the better insulin sensitivity, and it improves insulin resistance. It also changes your body composition and reduces all the fat surrounding your organs. It strengthens your bones. When you have children, you want to be able to play with them. You don't want to be suffering with osteoarthritis and joint pain. You have to lift weights, do something to build your strength, right? So not just cardio, resistance training as well. That muscle, let's say, is the organ of longevity. All ages, and every movement counts. If you're not exercising right now at all, start with 5 minutes, 10 minutes, and build those habits over time, right? Like compound. You all, I sure you have people here who in some type of pension plan or long-term investment. We know the power of compound interest. Same with exercise. Start small and build over time. All right, so just a little graphic here, the next slide. Now exercise, and I tell all my patients this, if you have a bad relationship with exercise or food, you're not going to do it, right? So this slide, the whole purpose of this slide is to kind of build your relationship with exercise. Now, let me just explain what it is very quick. I know we have like 10 minutes again. So that little piece at the bottom there, your BMR, right? This is basically, this entire graph is basically how much calories you expend every day, right? So let's just say a regular person might burn about 2,000 calories a day. This is just the breakdown of it. Now, basal metabolic rate, BMR, about 70% of that you have no control over. That is basically all the energy you expend daily. I'm just getting up and going to bed at rest. That is like your heart beating, your body producing hormones, it producing neural connections, your thinking, all these things like digestion, all these things like that. So that's 70%. Again, you have no control over this. Some people have fast metabolism, some people don't. Some people could eat whatever they want and not gain any weight. Some people could pass by a pot bubbling in Cora River and they swell up. It's because of your basal metabolic rate, and this is controlled by your genetics. You're just seeing that next part above they call NEAT. Now, these three ones here, NEAT, the TF, and the EAT, I'm just going to explain this very quickly. Exercise, and you can quote me on this, Dr. Brian Chadee told you, exercise is the worst thing you can do if you're trying to lose weight. But doc, what? Didn't you create a whole facility for exercise? Yes, but exercise is the worst thing you can do for weight loss. And do not think of exercise as a tool for losing weight. Exercise is the tool for good health. not for losing weight. Because that thing there on top called EAT, right? That stands for exercise, activity, energy, thermogenesis. That means the calories you burn from exercise. That little 1 hour, half an hour, you're going to the gym or whatever, and you're doing exercise, that could never challenge this or your basal metabolic rate or the other ones here, because this is just so short. All right, exercise is amazing for your health. Everyone needs to do it, but don't build a relationship with exercise as in it's going to help you to lose weight. It's going to change your body composition and improve your overall health. Now you see this other big chunk here called meat. This is a bigger portion, about 20%, you could say 20 to 25%. And this is all the activity you do throughout the day from the time you wake up to the time you go to sleep. Now, that is why we have guidelines and all these health experts telling you, hey, take the stairs instead of the elevator. Don't sit whole day, get a walking pad. Park far from the grocery and walk. It's because your overall activity throughout the day, your steps, all these things matter more for burning calories. You understand that concept? I'm going real fast.
No, that's okay. You go ahead. I think based on the chat, a lot of persons are appreciating this information and so on, and this sensitization. So
Good.
I don't know if I think we could take another 10 minutes perhaps. And so you take it up.
Sure.
Yes.
All right, no problem.
And yes, Christy, the recording will be shared.
Metabolic.
Yes, you go right ahead.
Basal metabolic rate, that is 70%. Yeah, basal metabolic, that is 70%. The other 20 to 25 is something called your NEAT, which is everything except exercise. All the movement throughout the day that is not exercise. And that is very important. That's why I want you guys to just move. Don't sit down whole day. Because that is what is going to make you gain weight. Move throughout the day. That little part called the TEF, well, actually, when you eat very high quality, nutritious food, you burn calories from that. Types of food you have to eat: foods high in fiber, which is fruits, vegetables, whole grains, and protein-rich foods. That is called the thermogenic effect of food. So you burn calories while eating food, right? Now, remember I was telling you how exercise is really good for your health? Well, actually, muscle mass burns more calories than fat. So if you go to the gym and you burn more muscle, that might actually increase your basal metabolic rate. I know I told you guys that that is what you will give on in this life, but you do have a little bit of control, not much, but a little bit of control by building more muscle mass, right? And that is what I have seen patients who have been pre-diabetic, even diabetic, and come off their meds once they follow these things I'm telling them. But you have to have the discipline, but you also need to acknowledge that things in your control and not in your control. All right. So this is just energy balance. This is the principle. Next slide. Energy balance is the principle of weight loss and weight gain. Basically, it's calories in versus calories out. If you eat more calories than you burn, let's just say you burn 2,000 calories, but you're eating 2,500 calories, you will gain over time if you're doing that consistently. And that is the only single proven principle of weight loss. Now, to lose weight, you guys probably heard about this term thrown over social media. You have to be in a calorie deficit. What that means is that the opposite. You have to eat less calories than you burn. So, for example, you're burning 2,000 calories. Well, I won't tell you go and eat 1,000 calories. You know why? Yeah, you'll drop the weight, but you'll gain it back because that is not sustainable. So you have to find a good balance, maybe like 1,800, 1,700, and stuff like that. And I help a lot of patients achieve that calorie deficit with correct behavioral strategies, proper nutrition, and all these things according to that individual. Remember, everyone is different. So what working for your wife won't work for the husband, right? So everyone is different. And this is just a little bit of complexity. The next slide about how many things affect this energy balance. Because yes, it's calories in versus calories out. But go and tell someone who's struggling with obesity and who is overweight to just eat less food now. Go and tell them to bring down their calories to 1,700 instead of 2,000, for example. It's very hard because these people are genetically susceptible to have an imbalance in hormones, which make them more hungry, make them less full after eating, make them expel less energy. All these things contribute to developing these metabolic diseases. Again, refer to what I said in my first slide. health and disease is complex and multifactorial. And I keep repeating this because part of this presentation is about misinformation, specifically misinformation that I see all over TikTok, Facebook, Instagram. And that misinformation is extremely dangerous. And you may think it's not dangerous, but in the hospital, I have colleagues who telling me about patients who are not taking their medication. They're going for the natural options and stuff like that. And they ending up in the hospital. Actually, just to give you guys a very popular example is Steve Jobs. Steve Jobs died from cancer, and you know why he died? You know, obviously we can't speak in absolutes and say 100% certain, but he actually chose a wellness route of taking natural juices and cleanses instead of going for his chemotherapy and the evidence-based approach. So that's just an example, right? Now, I'm not going to bash natural approaches and stuff like that. I'm all for what works, evidence-based medicine, but we need to get that fallacy that, for example, natural is better and stuff like that, right? Out of our head. We are all, I would say, intellectuals there and academics. So most of you all would be participating in studies and these things like that. All right, so that is that slide there. The next one, as I said, weight loss is very difficult. It is very easy for some and it's very difficult for some. For some people, especially those with overweight, East Indians, some people from South Asian descent, it is very difficult for them to lose weight because of all these things happening in their body. Basically, when they try to lose weight, the body will fight back. They're going to feel extremely hungry. It's going to keep that fat set point. All right. So next slide. Weight loss plans. Well, they have about everybody offering a weight loss plan now. Quick fixes, meal plans, all these things. But
Jenny Craig.
about 0.001% might work because they might just get lucky and that plan work for the person, but they don't know what they're doing, right? Most people don't know what they're doing. You know, you hear about the keto diet, the carnivore diet, the intermittent, all these things like that, blah, blah, blah. They're really, I mean, all these things work, eh? It works because some of them, they put in the calorie deficit, but you need to look at the bigger picture. Some of those things not good for your heart. It's not sustainable. People have eventually gain back the weight. They develop all kind of gastritis of the stomach because people with not the proper expertise putting them on these things. All right, so again, I want you to just remember that if you're on a weight loss journey right now, to not focus on your weight. Wait, doc, you're crazy. What are you telling me? Don't focus on your weight if you're on a weight loss journey. Yes, well, your weight is not a behavior, and studies have shown that if you focus on your weight when you're on trying to lose weight and you focus on that one variable, you're not going to, it's very unlikely you'll be successful. What you should focus on is healthy habits, such as I said, physical activity, getting your steps in, eating fruits and vegetables, working on your sleep, things like that, right? Don't focus on your weight. Relationship with food. Everyone has a different relationship with food. We all about sustainability. We want you to drop the weight, make healthier choices, but make it sustainable. Do carnival coming up, you're going on a crash diet, you're starving yourself, you're dropping sugars and carbs. When the guidelines show that we should have balanced meal, we should be eating carbohydrates. Those things are very good for you. Those things are important for brain function, for giving you energy. So balance, I want you guys to balance your meals, get all the nutrients, so carbohydrates, fats, your protein, your vegetables, your fruits and vegetables, all these things. And not only that, eating is not only for nourishment, but for pleasure, socialization, go out, have fun, and things like that, right? You have to find your balance. And if you can't find your balance, you can come check me. I'll help you find your balance. So alcohol, just want to touch on this. It is a known carcinogen. Alcohol causes a very few, not a few, a good few types of cancers. It causes alcoholic liver disease. There's the dependency on it, withdrawal symptoms, toxicity. In the next slide there, you will see that consuming alcohol increases your risk of developing at least 7 types of cancer: your mouth, esophagus, throat, larynx, breast, liver, colon, and rectum. And this has been proven last year. I believe the Office of the U.S. Surgeon General released this statement, right? So again, alcohol is something we use to socialize and de-stress and relax. This is just to bring some awareness and critical thinking to you guys to, just reduce your alcohol intake. I cannot make that decision and tell you to stop drinking. Obviously, no amount of alcohol is good, not even red wine. That is a myth. But just drink very responsibility. And if you have an option to drink less, choose that option. All right. So we come into
to link to what you said earlier about calories, it's also high in calories, which could
correct. Very good, Justin. Correct.
Yeah?
So, yep. 7 calories just from alcohol, just 1 gram. Correct. Very good. Yeah. So we come into the end. I just want to go through now the kind of misinformation aspect of presentation. I know it's a lot, but again, if you guys want me to focus on one individual topic, I'm very okay with doing that another time, right? So just a little bit to talk about on supplements. Now, the supplement industry, there's the what we like to say, the big pharma industry, and the big supplement industry, right? Now, the supplement industry is actually worth, I think they said about 28 billion. I'm not sure about the exact fact. And the pharmacology industry is about 4 billion. But anyhow, that just is just to give you guys again awareness and give you guys the facts, right? Now, I said that supplements are 95% gimmick, and I stand by that statement because a lot of these things they push out and have all these claims. But you guys need to understand that supplements are not regulated by the FDA. You can come and slap a claim and say it gives you energy, because remember, right? What is a problem we are having now in the world, right? We sleep in less, we're more stressed, we have no energy, so we chronically sleep deprived, we're not getting enough nutrients because we're eating like crap, all these things like that. So they're going to piggyback on these problems, these issues, and give you these claims. Come, I'll give you energy, I'll balance your hormones, all these things like that. But remember, there is no third-party testing on supplements. Some of them, yes, they have the third party, and that's the one I encourage you to use if you're going to use them. Right? So most of them not supported by high quality evidence, predatory marketing on the vulnerable. They offer false self-control over health. Natural does not mean safer or more effective. Remember that. Natural does not mean safer or more effective. It is something called a naturalistic fallacy that unfortunately a lot of us fall prey on because we want the natural natural option. But just remember, if something is natural and it doesn't have any side effect, that means it's not doing anything. Because think about it. If anybody study any type of pharmacology here, right? For a drug to do something, to have a positive effect, it's going to block a receptor. It's going to antagonize something. But if it's doing something, it's going to have an opposite effects. It's going to have an opposite effect. It's going to have side effect. That means it's very effective. It's the more effective something is, the more side effects it's going to have. And we accept that. That is why physicians, doctors like myself, for every patient, we weigh out the risk of using a medication versus the benefit. And if the benefit outweighs the risk, we go ahead. All right? If something claims it has no side effects, as in all these natural stuff, well, that just means it's not working. Right? And now working if it does side effects because it's not going to have a positive effect. And you see, and this is why all these fake experts come on and market these things. These influencers market these things because they don't understand how complex health, disease, pharmacology, science is, right? So as I say, there's a supplement for everything these days to boost the energy, for weight loss, blah, 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 everything. Now, medicine, next slide. Medicine is not perfect. Yes, it's a profitable organization. I acknowledge that. But you know what is the difference? You know what is the difference? It is regulated. You take 2 Panadol for the cold, right? We know exactly 1 gram of Panadol does this. We know the side effect profile. We know how to reverse it if you overdose on it. We know that 1 gram has 1 gram. Now, if a supplement says something at 1 gram, it could probably have 2,000 grams, or it could have 0.5 of a gram because there's no quality control and standardization, right? Now, just remember there, food is not medicine. Don't let any influencer tell you you can cure diabetes with just food. That is a kind of it's not a good statement to make because, as I told you, it is complex, right? Maybe some people could cure it with food, but not everybody. All right, so health on social media. Right, so TikTok, in the age of TikTok, Instagram, Facebook, all these things like that. Very attention grabbing, short form content. The algorithms love to push out sensational stuff, right? One of the problems is that unable to explain complex topics. There are no nuance, echo chambers. If any of you guys following things like the keto diet or the carnivore diet, once you get that one anchoring bias, what we call it, and you see one information that confirm your belief on that, the entire social media algorithm is going to put you in an echo chamber. And every single content you see there, you're going to confirm your belief. And you're going to get further and further away from critical thinking. And that's why you would have people comment like anti-vaxxers and stuff like that. Yes, it have they have some correct claims, but it's an echo chamber. And they make you discredit the scientific community and all these things like that, right? So in an age of information overload, at our fingertips, we have all the information possible. But how we know which information is credible or not, right? So I want you guys to follow real experts, sit down, identify your own biases. Do you believe that you have a natural or appeal to traditional fallacy, as in you believe that things is to work, the bush medicine and stuff is to, if you have that belief, apply to those biases and challenge your beliefs, right? Now we want healthy skepticism. You can't be too gullible and you can't be too skeptical, right? Anybody claiming to cure things like diabetes and cancer with a boost or a cleanse or a natural thing, question them, because again, health and disease is complex. Why would someone, a cardiologist, spend over 20 years studying how to treat these things? Why? What are they learning? They learn how to take your money? No. All right, so you have to be able to identify, as I say, these health fallacies, your beliefs. These days, a lot of us use what we call cognitive biases or heuristics, which is a shortcut for decision making, especially when you're scrolling through Instagram. So it's very important to understand those things. I was scrolling through Facebook yesterday and I saw this thing. So I was like, I have so much examples of misinformation, but I was like, this was a good one to show you guys. So Gil posted this, and I want to just say something about misinformation as well. Misinformation spreads. It spreads like wildfire. Look at how much likes and shares. If I come and tell you that the metformin controls blood sugar, I might get 2 likes. But remember now, if I tell you that someone's stroke, I can stop it with some pepper. Look how popular that spreads. And again, it's appealing to naturalistic traditional fallacies. It also has a little approach emotional bias there, because it appeals to your emotion. And before these 36,000 people who share this, you think they stop and had any critical thinking before they share this? Nah, they just press share. Now, everything about this thing is false, right? Obviously, pepper can't stop someone from getting a stroke. There are so many questions. Was he really getting a stroke? How do you know it really stop it? But things like that, right? But what I want to really show you is that how dangerous this could be. Someone could be actually getting a stroke, and instead of seeking medical care, getting a urgent CT scan, getting urgent what we call thrombolysis to dissolve the stroke, somebody say, nah, get them some pepper, and they kill the guy, right? So that is another reason how health information can be so dangerous. This is just some tips, next slide, on how to kind of navigate the social media space, right? So verify before sharing, cross-check information with reliable sources. You have the CDC, you have the WHO, you have American Heart Association, you have the Ministry of Health for your respective countries. Stay away from your biases, educate yourself about common cognitive biases that could cloud your judgment. Practice media literacy, learn how to analyze and evaluate online content critically, including social media posts and news articles. Embrace uncertainty. A lot of times patients come to me and I would just tell them, you know what? They want to ask me a question. I was like, you know what? I don't know of the information for that as yet. And don't be afraid of any doctors or think or judge them for when they tell you that they don't know. It just means that they are a good doctor and they are acknowledging on the limitations of science. While a scientific grifter, not scientific grifter, a grifter or a snake oil salesman, I like to call them, will come and tell you, yes, we have the answer for everything, we could cure everything, right? So embrace the uncertainty. We don't have everything. Take time to explore complex and nuanced topic, right? Follow qualified experts. You wouldn't go by a mechanic to change your plumbing, right? So you have to go by the experts. Listen to dietitians about nutrition. Listen to a cardiologist about your heart. Listen to an obesity practitioner about weight and chronic diseases. All these things like that. For example, I have someone who I go to financial advice or a financial advisor because all I know is medicine. So I need to go and seek out somebody to help me. They are the smarter person in the room. Learn to understand that you need to seek out other experts in other fields. And that is going to boost your overall health, your financial state, your quality of life, all these things like that, right? So seek out qualified experts. All right, so just to finish off, the boring stuff works, guys. Sleep, nutrition, physical activity, stress management, sleep, strong social connection, stop smoking, reduce alcohol, focus on the big things, not the pebbles, not like the supplement to go and give you this energy and things. PS, it doesn't work, right? There's some estimated fruit capita intake. So I just put this because I know we have a diverse population. Trinidad kind of in the lower limits. Guyana and Guyana basically at the bottom there. We should be aiming for about 400 grams a day and look at how much we're eating. But almost every Trinidadian have a mango tree, have a fruit tree in their backyard. So I don't know what is the cause. We need to do a study to find out why we're not eating enough fruits and vegetables because it is so good for our health. All right, so that is that. 7% of Trinidad eat 5 servings of recommended fruits daily. Now, this was a survey done in 2018, and it was predicted that less than 42,000 people in Trinidad in 2025, compared to 2018, would be enjoying, would be expected to be enjoying better health and well-being. So we're in a deficit. As time go by, more and more people are living unhealthier lives and lesser quality of life, right? All right, so I come to the end here. This is just a little graphic, and any question for you guys? If you look at this graphic, you will see that this is a supplement company, and the guy came up with the marketing tactics and schemes before they came up with the product. So he said, no additives, no preservatives, all natural. And then the company owner was like, I like it. Now come up with the product. And this is how they appeal to you. This is powerful predatory marketing because they know there's things people who have naturalistic and traditional tendencies, and they like to put organic, non-GMO, all these things. All right, guys, so I've come to the end of my presentation. I know I speak through this presentation, but again, it's a lot of information, health and complex.
That's perfectly fine. I think it served everyone well. You know, it was quite informative and insightful as I expected, and I think everyone has some sort of takeaway from it, you know. And so we thank you so much for that, Dr. Chadee. I don't know if you have any questions. You can take just about 2-3 questions. I know we were asking questions along the way, but any other questions that we may have?
Yeah, Justin, I don't have a question. I just want to thank Dr. Chadee. It was very informative, and I learned a lot. There were various preconceptions that were there were a few misconceptions that were refuted with some enthusiasm, and I wanted to say thanks for the very forceful way in which he presented. Thanks.
Thank you. Appreciate that.
Excellent. Clovine said, excellent presentation, very informative, thank you. Cassian said, I like what I hear, thanks. And very honest too. Very honest presentation. Yes, you know, Dr. Chadee is very passionate about and informed as well, and well educated in this field. And so you know, that's why we invited him to do this presentation for us. And by all means, if you have any, you know, if a question pops up later on, and you know, you can certainly contact him. He's very, very much active on social media as well.
You guys
I don't know,
can follow
Dr.
me on Instagram and Facebook.
Correct. So you could probably, if you want, Dr. Chadee, you can easily post your handles there in the chat by all means. So if anyone wants to get additional, guidance or seek consultation if possible, you could definitely facilitate that on your platforms as well. So thank you so much. I guess, well, since we don't have any questions per se, thank you so much, Dr. Chadee, for that very informative, insightful, interesting presentation. I think it definitely served us well. We are certainly much more informed, and I think this is something that we can apply to our personal lives and also to spread the word, and really help to educate others. And if you don't know, that's perfectly fine. As Dr. Chadee said, it's okay to say you don't know, just as a doctor would do. You can refer that person to someone who is more informed or the expert in the field. I'm happy to see that this has resonated with so many persons, and hopefully, Dr. Chadee, if you're available, we could probably have you back to do another presentation or webinar on something related, even diabetes. I know it was mentioned earlier.
Correct. Yeah, you guys can choose a topic. Diabetes is an excellent topic to speak about.
Excellent, excellent. So I'm very happy to hear that. Before we end the session, we just have a quick presentation, because we know that the ACHEA conference is coming up, and this year, ladies and gentlemen, it's being hosted or located in Turks and Caicos, a beautiful, beautiful, beautiful place. And so we look forward to that. It's gonna be I want to say a great time. Yes, it will be, but also insightful, very insightful in the academic and higher education, tertiary education sphere, as well as the administrative sphere as well. So just take a quick look at this video. I don't know if you can hear the audio, but you can let me know, and we'll get back. We'll close off after this. All right. So we look forward to hearing from you, everyone. Definitely thank you for coming to the session, and we hope it was very informative, and we look forward to our next webinar, which of course you'll get correspondence on the same thereafter. All right. If there are no other questions or no other comments, I think we can bring this webinar to a close. Thank you so much for your attendance and participation, and continue. Let's make a change now and live, be intentional about our diet and exercise as advised by Dr. Chadee. And thank you so much. Have a good